Hi, I'm Melissa Faller. I'm an OT here at QLI.
And I'm Sammy Porter, and I'm a PT here. And today we're going to demonstrate putting on some of our upper extremity braces. I think it's really important to get the bracing on correctly because if it's not on the right way, it can kind of affect the function of the brace. So today we're going to demonstrate how to put it on properly.
First, we'll start out talking about the neutral wrist brace. This might also be referred to as a Cindy splint or a Cindy brace. But essentially this brace is just to be helpful with someone's, their distal portion of their arm, ensuring that their wrist stays neutral. Whether this is to be helpful with joystick driving of a power chair, could be to help someone self-feed or brush their teeth or do some type of grooming activity. So with this brace, you will have a rigid side on the bottom and then a softer side on the top. That can be helpful in determining if it's a left wrist brace or a right. There's also a thumb slot, which can be helpful in determining that as well. So you'll just help your resident slide that wrist brace on, just ensuring that the position is correct by just making sure that there is a comfortable enough space in the thumb webbing. And then just gonna secure the 3 or 2, depending on what specific wrist brace you have. And just making sure that there is enough space to comfortably fit, 1 to 2 fingers below, just so there is room for circulation and isn't too tight. With the first time that you put this brace on, there's probably going to be quite a bit of excess of the strapping. That's safe to cut off. Your therapist might also cut that off for you. The next brace that we'll talk about today is the resting hand splint. There are a couple versions of a resting hand splint. Could have a more rigid option that might be worn during the day. This is a softer version that we would likely use overnight or for a prolonged period of time. Okay, to help a client put on this resting hand splint, we will use 3 straps to secure the hand portion, 1 on the thumb. With this specific resting hand splint, the straps are color-coded, which is really helpful in placing correctly. So we'll start with removing all the straps. We will fit the client's hand and tuck the thumb underneath on the thumb piece. And then we're gonna start with the strap furthest away from the hand or as proximal to your client's body. So we'll start with the blue to blue. This red strap is gonna wrap around the back of the hand underneath and then Velcro to the red. And then this one on top is gonna secure the fingers. Just one tip that I think is helpful when placing this, if you have someone who has tone or spasticity or just tight fingers, being able to help extend those, you can kind of fit your 2 fingers underneath their larger knuckles and help extend, and then use this last strap to secure the fingers. Lastly, once the hand is secured, we can take the thumb, we'll place it on the pad, and then we'll do a soft wrap of the thumb. The last brace that we'll talk about today is called an Omo Neurexa Brace. This brace is helpful for a client who might have shoulder subluxation or overall weakness in their rotator cuff that doesn't allow for their joint to be approximated appropriately. To help a client put on the Omo Neurexa, we will start with the front clip. We will loosen the bicep strap and loosen the forearm strap. Something that I find really helpful when helping someone put this brace on is feeding my hand through the opposite way of the brace, especially if your client has a flaccid arm or decreased strength. So you're just gonna help feed their arm through. And then we'll always start as close to the body, so we will secure the front clip. This strap is gonna go underneath their opposite arm. and secure in the front. Next, we will secure the bicep strap. And then lastly, we will just ensure that the client's arm is slightly flexed at the elbow, and we'll secure at the forearm.
And I think that's a really important component because when we put it on with the elbow flexed like that, it'll naturally kind of put my arm in a sling position to make it like a more comfortable and supportive brace rather than putting it on when my arm is fully straight. So I would really recommend making sure there's a bend in the elbow. Thanks so much for watching our videos. And if there's any adjustments that need to be made to the braces over time, like if strength changes or tone changes, or if there's any pain or discomfort, always remember to consult a therapist before trying to make those adjustments yourself, just to make sure that everything is safe and in the right spot.